Hello again, I'm Dr. Brian Hulsey at Foundations Chiropractic. You may have stumbled across this video looking for thyroid hormone interactions and maybe just following up with the series that we're doing. So I recently went through thyroid tests that need to be ordered, thyroid metabolism, all coming from the brain all the way down to the cellular level. And we started getting into some hormone interactions as well because of their importance. We just recently covered cortisol and its importance, and now progesterone. Well, I want to cover its importance as well. The main reason why progesterone is important, or adequate levels of progesterone are important with thyroid metabolism, they're important for many other reasons, but the progesterone is important because it can help increase thyroid peroxidase enzyme activity. Now, if you recall, this enzyme is an enzyme that puts together thyroid hormone from iodine and tyrosine. Just remember that it increases the enzyme's activity. This could be one of the reasons why checking body temperature is an effective way to see when a woman has ovulated. If there's problems with temperature, we may not be getting adequate progesterone release. So we usually get progesterone released in mid-cycle. Now this is halfway in between menstrual cycles. Because what happens is that we get an increased level of estrogen. Now this primes the brain to start secreting more luteinizing hormone, which now acts on the remnant or the corpus luteum after the egg has been released to release progesterone. This is going to help create a nice fluffy environment within the uterus for implantation. So the adequate levels of progesterone are definitely needed for many other things, but we need to activate the thyroid peroxidase enzyme. So some of the symptoms that you may have of progesterone deficiency include migraine headaches, especially in the second part of your cycle, heavy flow, cramping, possibly even miscarriage or infertility because we're not setting up an adequate environment for egg implantation. Possibly water retention right before menstruation, tendency for ovarian cysts. Ovarian cysts are usually appear in an estrogen dominant fashion, so we need adequate levels of progesterone to balance out estrogen. Now, progesterone levels definitely change around menopause. Why is that? So we recently talked about cortisol and how it's altered from with stress. We have a certain pool. That pool is called pregnenolone. Pregnenolone now goes into producing sex hormones as well as cortisol. So if we're taking away from that pool to help make cortisol, then we don't have enough pregnenolone left to make estrogen, testosterone, progesterone. So the woman especially relies more heavily on the adrenal gland, proper adrenal gland function to produce progesterone around menopause. If we're taking that hormone or taking pregnenolone away and producing a lot more cortisol from it, we're not going to be producing progesterone. So some symptoms that may come on around menopause would include migraine headaches, possibly water retention, adding to weight gain. You may not be having a regular cycle, so that water retention may stay there. But again, progesterone is very important because it's going to help increase thyroid peroxidase activity. And again, we want to see an elevation in temperature. This could indicate ovulation as well as increased progesterone because of the increased thyroid activity. This may not show up as far as on your thyroid hormone test, but it's enough to increase that woman's metabolism. So it would increase their temperature that way. So again, I'm Dr. Brian Hulsey. I hope you're enjoying this series on thyroid hormone metabolism and some things that could impact that. Have a great day.